Right now, if a doctor told you that you needed surgery, you wouldn't think twice. You'd schedule it, you'd show up, you'd let a stranger take a sharp blade and cut directly into your body on purpose while you were either awake or unconscious, trusting that everything would go fine. And here's the part that should bother you a little. Future humans might watch footage of that and react exactly the way we react to ancient Egyptians drilling holes into a living person's skull. Today, we're not guessing about the future. We're going to look at what cutting people open actually costs us right now, what's already quietly replacing it, and why the comparison to ancient surgery might not be as flattering to us as you'd think. Let's start with the numbers, because they're worse than most people realize. Every year in the United States, around 16 million surgical procedures are performed. And every year, somewhere between 160,000 and 300,000 of those patients develop an infection at the surgical site, a complication caused by the procedure itself, not the original problem they came in with. Zoom out further, and the CDC links an estimated 99,000 deaths a year across all hospital-acquired infections in America to infections patients picked up during their own treatment. We've built an entire layer of risk on top of the thing that's supposed to save us, and we've quietly accepted it as the cost of doing business. Cut the body open, hope nothing goes wrong on the way back together. That's modern surgery. Now here's where it gets genuinely strange, because we like to assume medicine only moves in one direction, forward. Smarter tools, more knowledge, safer outcomes, always improving. But that assumption doesn't hold up as well as you'd expect. Ancient Egyptian healers were performing a procedure called trepanation, carefully creating an opening in the skull to treat severe head trauma and seizures as far back as the Neolithic period, and researchers studying preserved remains have found that as many as 80 to 90% of these patients show clear signs of survival after the procedure. Now compare that to skull surgery during the American Civil War, thousands of years later, using what was considered modern medicine at the time. The recorded mortality rate was between 46 and 56%. Read that again. Ancient healers, working with basic tools, sometimes had better outcomes than doctors operating 2,000 years later with refined metal instruments. So, more advanced doesn't automatically mean safer. Sometimes it just means we haven't actually solved the real problem yet. We've just made the old problem look more sophisticated. Which brings us to right now, in 2026, because the real problem with cutting the body open has been clearly identified, and the alternative is already being built. It's called medical nanotechnology, microscopic tools smaller than a single cell, designed to travel through the bloodstream and work from the inside without ever needing to open the skin. Researchers are actively developing nanoscale tools designed to locate damaged tissue, clear blocked blood vessels, and deliver treatment directly to the source of a problem, all without a single incision. This isn't a far future concept pulled from a movie. It's an active, funded area of medical research happening in real labs right now, specifically because the procedure itself, not just the illness, is recognized as one of the biggest sources of risk in modern healthcare. So, picture the trajectory we're already on. We're not just hoping surgery becomes a little safer over time. We're actively building toward a version of medicine where, for many conditions, the cut might not need to happen at all. Now, picture this. Decades from now, a kid is standing in front of a glass display in a museum. Behind the glass, a surgical blade, some thread, a cloth mask. The placard reads, "Manual Surgical Tools, Early 21st Century." For generations, medical professionals treated illness by physically cutting open the patient's body, a method that regularly led to infection, scarring, and long recovery times, yet was widely accepted as routine and unavoidable. The kid turns to their parent and asks, "Wait, they let someone cut into them while they could still feel it happening?" And the parent says, "Yeah, and they considered weeks of recovery completely normal." That's not science fiction. That's just where the research is already heading. And honestly, this wouldn't be the first time medicine eventually made us wince at our own history. For over 1,000 years, physicians across Europe treated almost every illness you could think of: fevers, headaches, infections, with bloodletting, deliberately draining blood from a sick patient, because the medical belief at the time was that this rebalanced the body. It took centuries of mounting evidence before that practice was finally abandoned. Notice the pattern repeating itself. The data tends to show up first. The willingness to actually change shows up decades, sometimes centuries later. And right now, with surgery and nanotechnology, we may be living right in the middle of that exact gap between knowing the risk and being ready to let go of the habit. It's also worth saying this isn't some fringe theory from one lab. Medical researchers and major health institutions have already published projections suggesting that within a few decades, a meaningful share of procedures we currently consider major surgery could shift toward non-invasive methods instead. Not eliminating surgery completely, but significantly shrinking the list of things we believe absolutely require cutting someone open. So here's the real question this leaves you with. It's probably not, will medicine eventually move past the blade? The direction already seems fairly clear. The real question is, which side of this story do you want to be remembered on? The generation that recognized the risk and welcomed something safer the moment the evidence became undeniable, or the generation future humans talk about the way we talk about centuries of doctors who kept draining blood from sick people, fully convinced they were helping? The same way we talk about ancient healers who only had basic tools and still, somehow, sometimes did better than we did with steel. Either way, somebody's going to be standing behind a piece of glass one day, looking at a surgical blade, trying to understand why we waited so long to let it go. The only real question is how long that wait turns out to be.